We need to have Medicare for all.
For people out there who like their insurance, they don't get to keep it?
Well, listen, the idea is that everyone gets access to medical care. And you don't have to go through the process of going through an insurance company, having them give you approval, going through the paperwork, all of the delay that may require. Let's eliminate all of that. Let's move on.
Listen, I think I'm not saying that I'm the biggest believer in Medicare for all, but I think it's important that we as a Democratic Party have a discussion and debate the ideals for our party. Now, with that being said, remember, in the midterms, the #1 issue for voters was health care, because they were afraid that under Donald Trump, that folks with pre-existing conditions would lose their health insurance. They were also afraid about the rise in prescription drugs. And Republicans haven't had an answer to either of these problems. So I think we got to figure out an answer to these problems immediately. And right now, Republicans don't have an answer to them. And for folks who have health care, who their employer provides it, it's not a problem. For folks who don't have their employer doesn't provide health care is a big deal. Going to the doctor is a big deal, especially when you can't pay the bill.
Wow. Just back to the soundbite that we just played there, Matthew. Let's eliminate all that. Is that what sticks to her during this campaign?
And it would stick to her if she becomes the Democratic nominee. I think Senator Harris had a pretty good rollout. She had that big rally in Oakland. She had the good fundraising number in her first day. This was a major slip-up for her, which will haunt her if she makes it to the general election. And she acknowledged that by having her spokesman saying that Senator Harris isn't backing one Medicare for all plan, but is willing to look at other Medicare for all plans which would allow people to keep their private insurance. The fact is, Bill, most people are covered in this country, and most people who are covered like it. And that's the obstacle to these socialist schemes.